Today we are going to talk something about ourselves. We're going to talk about our company, our brand, and what basically do we do. Because the question that commonly comes is, what does actually the company do? So let's start. Let's understand a scenario. When companies talk about CSR, they usually start with one simple question. Where should we invest? But honestly, that is the second question. The first one is far more important. What kind of impact are we trying to create? Because when that question isn't answered clearly, even well-funded programs can quietly fail. Let me give you a very startling example. A company decided to invest in rural healthcare. The budget was approved, a partner NGO was selected, and a clinic was established in the village. There was an inauguration. Everything looked perfect on paper. 6 months later, the clinic was mostly empty. The doctor came only occasionally. Equipments sat unused, and villagers kept going to the hospital they already trusted. But why? Because no one checked what the village actually needed. The clinic was not the real problem. Staffing shortages were, diagnostics were missing, preventive care wasn't reaching people. And this is the difference between a felt and a real need. At that point, the leadership team asked a question we see in many programs. We spent the money, why didn't healthcare improve? The answer is simple. Good intentions alone don't create impact. You need research, you need structure, and you need continuous oversight on the projects. That is exactly where Finovation steps in. Our company steps in. 17 and a half years on ground work and thousands of initiatives across healthcare, education, livelihood, and natural resource management. Every initiative guided by deep expertise at every stage. Research to understand real need. Programs designed to plan practical, effective interventions. Partner selection with full due diligence, governance capacity, track record, and field experience all are checked before any recommendation to the corporation is made. Monitoring, evaluation, and impact assessment is also done to ensure programs achieve real results. Every specialized team focused on translating intention into measurable impact. That is the foundation we bring to CSR programs. CSR policy and strategic direction is something that is equally important. Let us go back to that same example. Before constructing a clinic, the first step would have been strategic clarity. Now you might ask, why do we need a CSR policy when the intention is already clear? It's a good question though, because without strategic direction, CSR investments often become fragmented. One project here, another initiative somewhere else. Each effort may be valuable, but collectively, they fail to create meaningful long-term transformation. At our company, we work closely with leadership teams to define organizations and their CSR priorities. Which sectors should we focus on? Which communities should we serve? What outcomes will define success 5 years from now, 10 years from now? A strong CSR policy answers these questions and aligns social investments with the company's long-term vision. Stakeholder expectation and regulatory requirements are mandatory. Once that clarity exists, decisions become strategic rather than reactive. Research and programs have to go through intrinsic designing process. In the healthcare scenario we discussed, the company assumed the village needed a clinic. But assumptions are exactly where many CSR initiatives begin to fail. Before designing any program, our research teams conduct need assessments, feasibility studies, and baseline surveys to assess the situation. We analyze the geography and the demographics, existing infrastructure, community behavior, and very often the findings change the entire direction of the project. In our example, the research might reveal that the village already has a primary health center. The real problem might be something else. Perhaps there are no trained health workers. There are lack of diagnostic facilities. Perhaps awareness about preventive healthcare is extremely low. When the problem is correctly understood, the solution becomes far more effective. Instead of constructing another building and infrastructure, the program might focus on training of community health workers, introducing diagnostic equipment, and strengthening existing healthcare systems. Same CSR budget, far greater impact. Partner due diligence and implementation done. Designing a strong program is only half the journey. The next big challenge is execution. One of the most critical decisions in CSR is selecting the right implementation partner. We conduct detailed due diligence before recommending any non-governmental organization or any implementing partner. We assess governance systems, financial transparency, program experience, and most importantly, the field capacity of the agency. Because even a well-designed initiative can fail if implementation partner lacks the ability to execute it effectively. Once the partner is selected, we establish clear operating procedures, SOPs, timelines, and program frameworks to ensure that every stage of the project unfolds as planned. Then comes the stage of monitoring, evaluation, and learning. But responsible CSR management does not end with implementation or MEL. A program that is not monitored cannot be managed. Here we develop structured monitoring, evaluation, and learning frameworks for every initiative by specialized teams. That means baseline studies, defined performance indicators, periodic monitoring visits, and midterm evaluations are carried out on result-based metrics. Returning to the healthcare example, we would track indicators such as, are more patients accessing healthcare locally? Are trained health workers providing regular services? Are diagnostic tools being used effectively? Continuous monitoring allows us to identify the gaps early and make sure that course corrections are done before the program drifts far away from its intended objectives. Impact assessment and long-term value is the final stage. And this stage matters the most as far as reporting is concerned. Impact. Because CSR success is not determined by how many activities were conducted. It is determined by whether lives actually improved. Did healthcare access increase in the community? Did early diagnosis improve the health outcomes? Did families spend less time and money on traveling for treatment? Through rigorous impact assessment exercises, we measure the social, economic, and the environmental outcomes of the program. These insights help organizations understand the real value created by their CSR investments and guide future initiatives. The role of Finovation is basically that when you step back and look at the entire journey, one thing becomes very clear. CSR success is not about how much money is spent. It is about how thoughtfully the investment that you made is planned, executed, and evaluated. And that is our role. We bring research, structure, technical expertise to every stage of the CSR life cycle, so that corporate intentions translate into measurable, meaningful, and lasting impact. Because when CSR is managed with the same discipline as business strategy, it does not just fund projects, it transforms communities. If you are a corporate leader and you're looking to turn CSR intentions into measurable impact, you can connect with us in the link given below, and we shall be more than happy to help you through. But make sure next time you follow the basic guidelines to ensure your CSR project becomes a reality that is not only projected but is effective.